I joined Newark Beth in September of 1989, and Dr. Fuseschi joined me in January of 1990. About 5 or 6 weeks later, on February 20th, I believe, we did our first heart transplant. That patient is still alive today. At the end of the first year, we completed 12 transplants and had discharged 11 patients to home. Within approximately 2 years, we'd performed well over 40 or 45 transplants. That prompted us to expand the scope of services from heart transplantation to include left ventricular assist device placement as well. One of the things I didn't quite realize when I first got to Newark Beth Israel Medical Center was the impact of those 15 or 16 transplants performed in the mid-1980s. The legacy of those transplants from the 1980s had a significant negative impact on our ability to attract patients in those early years. It took quite a bit of marketing to obliterate that negative legacy, for lack of a better description, over those first few years in the program. I alluded a bit earlier to the fact that we did 12 transplants in that first year back in 1990. This year we anticipate doing approximately 38 to 40 transplants. Our growth is somewhat inconsistent with the experience elsewhere in the United States. Most programs plateaued somewhere in the mid-1990s and haven't been able to maintain their volume since that time. In our case, however, Newark Beth Israel Medical Center was bought by the St. Barnabas Healthcare System in 1996, and the St. Barnabas Healthcare System made a significant commitment of dollars and resources to the heart transplant program. So whereas in the early 1990s we had settled into the range of approximately 15 to 17 heart transplants per year, our volume began to increase such that by the year 2001 we were doing 30 heart transplants in any given 12-month period.
There have been so many examples of how this team has come through above and beyond what a normal team what would be expected of a normal team. One that comes to mind very clearly is a time when around midnight we were called with a donor on the table at another hospital, and the heart team that was supposed to procure that heart turned it down at the last minute. And so here is a donor, due to time constraints, if they didn't find another heart team to accept this heart, the heart probably would not be used, and it would have been a loss of a precious organ. And at midnight, we mobilized a team, obviously from home, to get here so quickly that we had the patient on the table and ready to go within 90 minutes. I've never seen that before in my 25 years as a physician. It turned out to be such a wonderful outcome for what would possibly be a terrible outcome, meaning, the loss of the organ. So that's just one example of how this team has come through. We've had at least a dozen times over the last 3 years. We've had situations where we've had to do 2 transplants a day, back to back, and this team handled it without a problem. In fact, there was one day that we did 3 transplants in one day. Each of those recipients was a reoperation recipient, meaning they had had previous heart surgery. So it was, much more difficult dissection. All those 3 patients did beautifully.
The other thing that I think is important to point out is that Newark Beth Israel's success is partly related to the stability of the team. And when you look at programs such as Temple or Hahnemann or Loyola, where I came from originally, one of the reasons that most of these programs got into trouble was that people were recruited and left. And I think that the stability of a team ultimately engenders familiarity with referring doctor. It took us 2 or 3 years before we realized that heart transplantation in and of itself was not going to be the entire scope of services provided. And in fact, today I don't really think of ourselves as a heart transplant program. I think of ourselves more as an end-stage heart failure program, which happens to encompass heart transplant services, implantation of mechanical cardiac assist devices, ECMO, lung transplantation in certain cases. Some of the future technologies which we're about to embark upon now include skeletal myoblast implantation, gene transfer, and a variety of new mechanical cardiac assisted devices. It's interesting because when you think about it, as I said before, we were a very small program back in the 90s. Today, Newark Beth Israel Medical Center is one of the largest LVAD implanters in the world, certainly in the nation, if not the world. And we were one of 40 sites chosen internationally to participate in the the BioHeart Marvel skeletal myoblast trial.
Because we have worked together many years and we work with such fluidity in a way, it's a well-oiled machine. Everything moves as efficiently as possible, and yet, due to the skill of the various people on the team, should anything unexpected come up, we've been able to handle it without a problem. I think I speak for all of them. We love what we do. We love working with each other. And I think that, again, this 500th transplant, this milestone, gives us the opportunity to sit back and just realize how lucky we are to be a part of this system.